What is up, Heads or Trails crew? Welcome to the Achilles Pain Talk with Trail Running. I am Dr. Mark Murdoch. I run a sports chiropractic practice in Vernon, British Columbia. I'm an ultra runner and a trail runner. Work with a ton of people who love to hit the trails for long distances. We call those adventure athletes. If you're spending your fitness points outside and you're spending your time doing what you love in the outdoors, our kind of main goal is we help runners get back to running unlimited by pain faster and further than before. Kara sent me a message asking me to do a talk for you guys, and we're going to talk about Achilles pain because it is pretty much spring, or at least it's getting to be that way in the North Okanagan. And one of the first injuries I see coming around the corner when we're reintroducing volume is Achilles pain. And we're going to talk about why that is. So if you're listening to this, there's a good chance you have Achilles pain because it's pretty common in kind of middle and long distance runners. And then we're going to first talk about what an Achilles is and what a tendon is and kind of what to look for when you are injured and what to do and how to kind of intervene. So a tendon is essentially a piece of soft tissue known as collagen or a lot of cartilage that is in the tendon as well. And it transfers force as its primary function. So it attaches a muscle to a bone. In this case of the Achilles, it attaches the calf muscle to the heel bone. The calf muscle is primarily made up of the gastroc and the soleus. Those are kind of two of the big muscles. If you look at someone who is contracting their calves, you can kind of see those two big muscle bellies. Those are the gastroc, and then deep to that is the soleus. The number one function of a tendon is to store and transfer force. So it essentially acts like an elastic band. So while that tissue is not contractile, meaning that tissue doesn't generate force in and of itself, it stores and transfers force. The Achilles primarily transfers force in the plantar flexion direction. So if you go up on your tippy toes, that's plantar flexion. If you bring your toes as far up towards your nose as you can, that's called dorsiflexion. It's an often irritated area in runners. There's a lot of terms that people like to use: Achilles tendonitis, Achilles tendinosis. The number one term is Achilles tendinopathy, and that basically encompasses any sort of Achilles tendon related pain, and that's how we're gonna define it. And it's very often irritated in long distance runners, especially in the spring when we start to introduce some hills. So there's three different areas that tendon can be irritated. There's the musculotendinous junction, which is basically where the muscle and the tendon meet. There's a mid portion or middle of the tendon, and then there's insertional Achilles pain. So if you have Achilles pain, you can pretty much just call it Achilles tendinopathy. We don't necessarily need a diagnostic image to be able to do that. If you're trying to diagnose Achilles pain, or if you're not sure if you have it, one of the tests I use is called the pinch test. So you just take your thumb and your finger, you'll pinch the tendon kind of from side to side. If there's pain, that's a good indication that that tendon is irritated, especially if there's a difference side to side. Two more tests that I often use, or two pieces of information from the history: if you have stiffness when you wake up in the morning and that Achilles tendon, and then if you have pain with going up on your toes or with the first X amount of running. Essentially, if there's pain on the tendon, we're going to call that Achilles tendinopathy. So the cause of Achilles tendinopathy is pretty straightforward. It's simple, but not easy to decipher because it's basically your load is exceeding your capacity. So load is broken up into a couple different parts. We have the volume, the intensity, and the frequency. So essentially you're doing too much too soon compared to your preparation and your capacity. So that could be you're introducing too much overall volume. So maybe you go from 10 kilometers a week to 24 kilometers a week, huge increase in volume. Maybe you are changing your intensity. So you've been doing a lot of zone 2 runs, and all of a sudden you're now pushing those paces and doing a lot of tempo. Or maybe you go from running 1 day a week to 3 days a week. Regardless, you are pushing beyond what you are prepared to do. The catch here is that this is true for all overuse injuries. It's not just true of Achilles tendon pain, because pretty much all running related injuries are overuse injuries. Now, when it comes to Achilles specifically, because one person will go out and run and they'll have knee pain, and then the next person will go out and run and they'll have Achilles pain. Everyone's going to adapt a little bit different. Everyone kind of has their shortcomings. But most of the running related pain tends to be tendon related pain, mainly because the tendons are slower to adapt than the muscles. Like muscles, lots of blood flow. They tend to adapt really, really quickly. So does our cardiovascular system. But the tendons don't have as much blood flow. It takes a lot longer for them to adapt and be prepared for the demands of running. Specifically, the Achilles, we can see anywhere up to 7 times your body weight worth of force going through that Achilles every single step. So if we're all of a sudden adding in a ton of volume onto that Achilles that has not adapted for the season, no wonder that Achilles is so susceptible to pain. So there's a couple different risk factors when we're considering the Achilles that we want to keep in mind. I like to break this into things that we can control and things that we cannot control. So we can't control our family history. We can't control if we have previous surgery or bony anomalies that limit our ankle range of motion. We can't control genetic variation, not a ton of control over systemic disease, kind of all these uncontrollable factors. So instead of focusing on that, if you have Achilles pain, we want to control what we can control. So how strong are your ankles? Is the abnormal ankle range of motion due to lack of stretching and mobility? Is there a sudden change in running volume, uphill running, chronic versus acute workload, that sort of thing? So all of those things are things that we can actually control rather than focusing on things that we cannot control. So one of the best examples I use, especially this time of year, are the chronic versus acute workload, and then how much uphill running are you introducing. So a lot of times in the spring, we have runners that are switching from road running to trail running. Trail tends to have a lot more uphill, a lot more vertical. If we look at the graph in the picture here, as we start to add an incline, we can see almost a 8% or above a 7% increase in Achilles strain. Now, the vice versa is true, where if we are running a lot of downhill, we tend to see a lot more loading of the knee joint, of the patellofemoral joint. So that gives us a pretty good idea of what factors are leading to some of these injuries. When it comes to injury prevention, it's a very complex topic. There's so many things that can influence your injury risk. This is my injury prevention pyramid. So at the base, down here, we have our sleep, our strength base, and our aerobic base. Those tend to be the 3 largest pieces of the puzzle when dealing with injury prevention. And then kind of going up the puzzle from there, we have our 30-day volume. So what did we do over the last 30 days? And then how was our nutrition over the past 30 to 90 days? And then on the tip of that pyramid, that can kind of tip things over, is how did we handle a single training session? So you can have your acute injuries, or you can have the volume that just pushes you over that limit, the straw that broke the camel's back, that sort of philosophy. All of these things are going to feed into your risk of developing an Achilles injury or any other form of running related injury. So regardless of the specific running related injury, these are all overuse injuries. Achilles tendon, snapping hip flexor pain, runner's knee, stress fracture. All of these things are because we did too much too soon and we're not prepared for it. There are exceptions. If you step off the curb and roll your ankle, if you crash into a tree, if you're doing sprints and you feel a sudden twinge in your hamstring, those are more acute injuries, but they're not typically what we see and not typically what we call running related injuries. They tend to fit into a different category. So the overuse philosophy, if you look at the right side of the screen, you have that arrow, that red arrow, and it says injury threshold. That is our kind of dotted line. And then our training load, if it exceeds that amount, we are going to get injured or we're going to start experiencing symptoms. When it comes to the tendons adapt slowly. So if I do too much too soon, my tendon is not recovering from my previous workout before I'm introducing my next one. That builds over time. And now all of a sudden I start to experience pain at lower loads. So regardless of the type of running related injury, generally it's going to fit into this pattern and this category. So what do I do when I do get injured? Well, the first thing that we need to do is talk about the 2 options that you have when you get injured. You can either increase your pain threshold by building tolerance back up, or you can decrease your activity, which decreases the demand. In reality, we want to do both. We want a relative rest period, not an absolute rest period. So an example of that would be, let's say you have Achilles pain that comes on at kilometer 3 every time you do your loop. Okay. Instead of doing 0 kilometers out of your usual 10, we're going to do 2.5 kilometers. It seems really simple. It's because it is, but that's not always easy. So that's our period of relative rest. And then on the flip side, we want to develop Achilles stiffness, calf strength, ankle mobility. All of these things are going to increase my pain threshold to increase my tolerance to injury. But what most people end up in is they end up in what's called the running injury purgatory. So top right, let's say you develop a running related injury, and then you go to that bottom right, and then you offload the injured tissue. So I have knee pain. Well, we'll use Achilles pain when we're talking about Achilles. I stop running because I developed my Achilles pain because I went back to running in the spring at the same kind of running intensity and volume in the same trails that I was doing in the fall. So I need to offload my tissue. My tissue loses capacity because I'm not doing my activity, but my pain also goes away. But then I return to an activity too early without compensating and without developing that increased tolerance. My injury comes back. And then I offload the tissue. My pain goes away. I return to running. My injury comes back. And we end up in this injury purgatory. What we need is we need an extra step in here, and we need a plan. So instead of going from injury to complete rest to no pain and then back to running, we need to add in a step here. So we go through 3 phases at base camp. First is our reset phase. This is where we're primarily worried about the pain and the symptoms. We're trying to decrease pain as fast as we can. Phase 2 is restore. So we're trying to work on mobility, strength, endurance. And then phase 3 is going to be our reload phase, where we start to reintroduce volume, reintroduce hill running, reintroduce higher threshold activity. So when it comes to the Achilles specifically, sometimes we're going to use pain control for that first phase. So isometrics is a great way to do that. Lie on your back, press the balls of your feet into the wall kind of as hard as you can, get a good contraction out of that calf and hold that for 10, 30, 40, 60 seconds. That's going to help with the actual amount of pain going through that tendon. It can be really, really helpful for that. And then we work on tendon adaptation. So one of the most important things for tendons is that we re-establish stiffness in the tendons, because a stiff elastic band is going to produce and recycle more force than a loose elastic band. Then we work on some calf loading progressions, start to introduce a little bit of speed, and eventually we move into power development, jumping, bounding, skipping, and then reintroducing running at whatever the previous painful threshold was. Okay. So I kind of touched on this earlier, but the answer for tendon pain is not rest. If you rest, you're not going to be able to return to the activity at the same level than you were before. Relative rest, yes. Complete rest, no. Okay. When it comes to optimizing your recovery process, we need to focus on 4 big factors, 4 big levers. Your movement quality, so that comes into the tendon stiffness, the ankle range of motion, the calf strength. And then we're talking about sleep and recovery, nutrition, hydration, stress management. This can sound overwhelming, but at the same time, it should seem empowering, because now you have 4 different portals of entry that you can start at that have nothing to do with the running itself. We do want to get you back to running. Your rehab plan should look and involve some sort of running if you want to get back to that as your activity. It's really important to remember, human beings are meant to adapt. An injury doesn't mean the end of your running career. It just means that you need to take some time back. You need some relative rest. View it as an opportunity to work on all of the corners and the holes in your game so that you can come back faster, stronger, and a more resilient runner than before. We've had tons of patients go through this. When you finally get back to activity, when you start reintroducing running, all of a sudden it's like, man, these hills don't feel as hard as they were before, because we start working on things that may have been neglected in the past. So we work with runners in 2 primary ways. We have our Super Runner program and our Run Strong program. Run Strong is a in-person or online or hybrid strength training program for runners. And our Super Runner program, this is for injured runners looking to get back to running, where we do what we call our Super Runner assessment. We see where you're at on all of the aspects of running: mobility, stability, strength, endurance, that sort of thing, so that we can put a plan back together to get you back to running at the level that you wanted to before. We also put out a lot of good stuff on Instagram and on our blog. So if you want to follow me, Basecamp Doc on Instagram, and then basecampclinic.com is how to get a hold of me. I've been injured before. I've had my running limited before. I had to work back into loading the tissues and loading the the injured areas. Pain sucks, but it doesn't have to be the end of your running career. If you have questions, feel free to reach out to me. Feel free to reach out to our team, and we can get you back to running after Achilles pain, or better yet, we can prevent it so that this spring and summer you can have an epic trail running season. So thank you so much for listening to our talk. If you have any questions, like I said, feel free to hit us up. We love this stuff. We're nerds about it. So reach out and we'll be happy to chat.